The views and opinions expressed during this program are those of the hosts, guests, and callers and are not necessarily those of this station, its management, or other employees, advertisers, or sponsors.
Good morning. It is Wednesday, August 6th. I'm Michelle Dials, and you're listening to Talk of the Town on 1230 WSAL. Joining me this morning from Logansport Memorial Hospital, Vicki Bird is here. Good morning.
Good morning. How are you today?
I'm doing well. And you have a guest with you as well.
I do. I have Jeanette Huntoon, our Chief Executive Nurse.
Good morning.
Good morning. And we are talking about quality measures today, correct?
Quality measures and just quality, overall quality, our initiatives and why it's important.
And Jeanette, I heard a presentation that you did at the Logansport Memorial Hospital board meeting, and the amount of data you track, it was just fascinating, the things that you guys are doing to keep track and to improve and continually improve quality at Logansport Memorial Hospital.
That is absolutely correct. There's a lot of required elements that we do collect for Medicare, Medicaid, for insurance payers. But the one thing that I think that we notice, we do it for ourselves. We do it for the community. We think it's the right thing to do, and we want to hold ourselves to a higher standard that maybe even a regulatory body would hold us to. So we probably collect over 250 measures.
Wow. That's a lot of data. Now, how long have you been in your position?
Well, I've been the chief executive nurse for about 12 years, but I've recently acquired quality. Actually, I shouldn't say recently because it's been about 3 years now, but it was the perfect fit. It has a lot to do with patient care. It has a lot to do with the physicians looking and using best practices. And it has a lot to do with the frontline staff taking those best practices and making sure it reaches the patient.
So let's start at the beginning with this. What are some of the things that you're measuring?
Well, the thing that we do a lot in the background that I'm sure a patient may not realize, but if you were to come into the emergency room, I know we've had our challenges in the past, and we really are working on that, but we've worked on a turnaround time. We look at how long does it take a patient to get from the time they reach the front desk to back to a room. And then we also measure how long does it take the physician to get in there. And if someone comes in with a heart attack, we measure how long does it take to get that EKG, because we know that if we can get an EKG to a patient very quickly, we can really impact the outcome for them to have good survival rates. So lots of elements, everything from the antibiotics you take before surgery to if you have a chronic disease, we measure the kinds of interventions that the physicians would order to make sure it's a best practice on all of the great evidence that's out there today.
Now, outcomes is a word that you use a lot, and in several different ways. I mean, you've got hospital outcomes, clinical outcomes, patient outcomes. I mean, like lots of different outcomes. What does that mean?
When you're talking quality, an outcome is a desired effect. When you do something, you should know that you're doing it first and foremost for the right reasons. And then second of all, you're doing it so you can replicate that expected result. So if we know by taking care of a congestive heart failure patient, we can get them back into a physician office within 4 or 5 days or sometimes a week, I know that I can impact their ability not to come back to the hospital and be readmitted, because we have looked at all of the evidence out there and our physicians have chosen that that works best for patients.
Now, how much of this is driven by Logansport Memorial itself versus outside forces like affordable care, that sort of thing?
I would like to say that, we were ahead of the curve, but we were not. We are like every other hospital in this nation where we do probably 2/3 of what we do because it's required measurements. But I will say there is a large push, and we have taken the ball and really ran with it with a reduction in harm. It's a campaign that's going on nationwide. The state of Indiana, I participate in a hospital engagement network with all other large and small hospitals, and we look at 11 different indicators where we can reduce harm for patients in hospitals, because we know that when a patient comes to the hospital, they're vulnerable. They don't want to be there most of the time unless they're having a baby, but they don't want to be there. So we want to make sure they don't get any other complication while they're there, that we do it right the first time so they can go home and do the kinds of things that they want to do.
Now, Vicki gave me a little bit of a cheat sheet here, and you've got some various measurements. Do you want to talk about some of those?
Well, I'm really proud of this. In the last 3 years, we have gone from probably being, I would say, about 25th or 30th in the state with measures that look at your care in surgery. We look at congestive heart failure. We look at our heart attack measures. We look at people who have pneumonia. And then Medicare ranks us across the nation and across the state. And I'm happy to say that on an average, when you look at those indicators and you put in hospital-acquired conditions, which are like infections you might get if you're in the hospital, we are number 1 this year.
Wow.
So we have done a great job. Our staff, our physicians have just done a tremendous job making sure that the patients get the right thing. We're working really hard to make sure that those things are into the everyday work we do so people don't have to remember, oh, did I give that antibiotic? But we can use our electronic health system or our medical record to kind of trigger and ask those questions. Did you give this antibiotic? Was it in the right time frame? And we push ourselves. The government may say you need to measure it from here to here, but we go ahead and take it a step further, and we look at every failure and say, hey, that could be my mom, that could be, somebody else's daughter, and we don't want that. So we take those things very seriously and sit down and kind of tear it apart and say, what could we have done differently, and how can we make that better?
Now, that number 1 rank, is that in the state? Is that...
It's in the state, and it is an average. So it doesn't necessarily mean I'm number 1 with pneumonia. I'm actually number 4, or number 1 with heart failure. But when you add all of those scores up together, we have come out on top this year. We were 4th last year, and my goal was to try to improve it. You kind of never know how it's going to fall because you don't know how all the other hospitals are doing. But I was very pleased to see that, we actually, on average of all of those different indicators, we came out as number 1.
Very cool. Congratulations on that.
Thank you.
Now, one of the things that's on here is the Leapfrog Group Hospital Safety Score. What's that all about?
Leapfrog is an organization that a lot of Medicare patients will take a look at. It's really kind of a way to take a look at healthcare quality scores. It's one way you can take a look at it. And they grade us, and they take a look at lots of different indicators. All the different measures I listed before are things that they would look at. They look at our availability to make sure that we have adequate staffing of physicians, like in the intensive care unit. They take a look at whether or not you can respond quickly to codes and how many have you had. So they take a look at a lot of different things to ensure that you're providing the best care, and then they assign you a grade. A obviously would be the top grade, and I think D is the worst grade, and we were very happy that we were a B. There's some things that made us a B because we don't have like an intensivist in our ICU, so you got your score knocked down by the virtue of not having something that a large hospital would have. But I was very pleased with the score of a B, so that was a nice, happy find that I saw when we were looking through some data.
And Vicki, I'm going to bring you into this for a minute. This kind of reminds me of an experience we both have with United Way, because we asked the agencies to start tracking data and that sort of thing. And like Jeanette said, she'd like to say that they were at the forefront and implemented this on your own. But one of the things that you find when you start tracking data, I think, is that people are so busy doing their job every day that then when somebody comes along and says, okay, now you need to track this, this, and this, then it almost kind of grows on you that, okay, we're tracking this, maybe we should be tracking this too and that. I mean, is that something that you guys are finding, is that your staff enjoys knowing these things?
Well, I think I don't know if they enjoy always,
tracking data is never
tracking
fun.
data is really never fun. But I think one of the things that we've become better at over the last several years is using the information that comes from the data. And that's, you can track data until, the cows come home and it doesn't mean a thing. What you really then need to do is to take that data and use it to inform process improvement, how you do a delivery of services to your customers. And so I think that, in my mind, that's the enjoyable part of data.
And I think that's where I was going with the United Way stuff. When we first asked them, okay, hey, start tracking all this data, it was like, oh my gosh, this is something else we have to do on top of everything else. But the information you get out of it about the outcomes is so valuable to the community.
And then that's what helps us continue to I guess grow as a facility and to become even better with the care that we provide to all of our patients and our customers.
I would agree. I also think we do take a lot of time to say, is it value added? I am not going to collect data for the sake of collecting data. You're right. We don't have time to do that anymore. So what we do look at is this something that's going to change the care for the patient I take care of? And if it's an affirmative, then absolutely we're going to look at that data. If it's required, I don't have a lot of choice. And their collection is very scripted. It is audited, it is validated. So it isn't, I can't just make up numbers, but you have to send in records for them to validate and make sure that you are collecting it accurately and that the numbers do reflect the care that you're giving.
Have you seen specific instances where it has changed the way that you provide care?
Absolutely. I think one of the most exciting things I get to do is when you have a new physician that comes in, and I always get them for my 20-minute talk on quality, and they will look at me and go, yeah, I've heard that before from where I've come from. But when I show them an actual scorecard with their name on it and the practice that they provide, and I can show them that in our hospital, in a 7-year time period, I have never had a ventilator-associated infection. Because of the practice of the physicians and the nurses, it resonates with them that, wow, I don't know that I want to step out of that box and be the little dot on the graph here. So it's very powerful when you get to show people that their outcomes and their practice matters. And I think that's another thing. We've been very transparent with our data. We are getting ready to put together on our quality council, we have an actual patient, we have a patient advocacy council, and we have a member from that sits on our quality council and helps us bring back our work to the patient and ask those hard questions about, but what does that do for me? What does that do for my wife? What does that do for my grandchildren? And they're just great questions. First year that we've ever done this, but we want to get the public more and more involved. We have an OB quality council now as well, and they are just very dynamic and looking at how they can help us rearrange the care that we provide so it's more family friendly, it's safer, there's a reduction in harm, whether it's elderly people falling. And we walked around to every room, and this patient advocacy council said, you don't have lights here. They can't reach the light, so they're getting up in the dark. So little things that we take for granted, they have been our eyes and ears to be able to say, this makes it better.
So is this the entire hospital as an organization that's involved in this?
We have representatives from all different disciplines, and then they take that message out. We decide on what it is the frontline wants to know, and we ask them every year, here's what we're going to show you because we think it's really important about the work you do. But every department has a scorecard that they post on the work they're doing so that they can connect the work they do to a purpose of, I helped prevent that patient falling, or if they did fall because they were elderly and they got up and they didn't realize what they were doing, they didn't hurt themselves. We were able to get in there and lower them to the floor, so there wasn't a significant injury.
So how does all of this then translate to the community, translate to patients, that sort of thing?
You know what? That's probably our hardest challenge, is how do you get something that people expect you to have out there to say, please help us be better. We are not perfect. We know that, but we really are trying to make a difference in the care that we provide in this community. We want people to be proud of what we do. I'm proud of what my nurses do and my doctors and all of the support staff that goes along with it. It's a team. It truly is a team, and nobody does it by themselves. No doctor does it by themselves, no nurse. And our goal is to really get the message out there that if you come to our hospital, it is a high quality organization that's going to take good care of you. And if we don't, we want to make it right.
Are there opportunities then for patients to provide feedback?
There is. We have a patient advocate, Tara McVeigh, who's my director of nursing, and she takes those concerns. And so all of our managers, our frontline staff, I do a orientation with new staff that lets them know if you have an issue with a patient or patient's unhappy or they don't feel like we've provided the right care, here's what you need to do. So everybody knows how to elevate it. Everybody knows who to call so that we can make sure that we take care of those issues the best we can.
So then is the hope that all of this will help someone to choose Logansport Memorial Hospital in the event of a time of need?
Absolutely. I want people to say, if I go there, I'm not going to come out with an infection that I might get in an Indianapolis hospital. These people have really done a good job making sure people don't get sick while they're in here. And that is a huge thing in this day and age. One healthcare acquired condition, let's say MRSA, which is really big and rampant, can cost a Medicare patient, upwards to $50,000 in additional monies, and not to mention their loss of. It could be their loss of activities that they want to do. It's a very much life-limiting thing, and we take it very, very seriously. I have an infection control director who's just religious about ensuring that we do the right thing. And we don't have a problem following her direction. Because we have the outcomes to prove it.
Now, the sheet that I have here, it says fewer than 50% of Americans over 26 gather extensive information before a hospital stay. Is that because it's generally an emergency situation?
I would say for younger people, that is true. I think for older people, they just don't think about that, but I would say those middle-aged people they're starting to get extremely informed about how they want to make those decisions. If they're going to spend good money on healthcare, they do want to make sure that they're going to get all of the expected elements out of that money that they're going to spend. And they should. We should be held accountable for the care that we provide.
So that's where then outcomes would play into this, and they would be able to look for that information? Absolutely. Now, is this information going to be, where is it available? How do they find out?
It's currently available on Hospital Compare, but what people need to realize is that that's old data, and so they may be a couple of years behind. They can go into any organization and ask them about their infection rates, and they should. If you're going to have surgery, that's the first thing I think about. I was recently on a leadership trip to California, and I thought to myself, if I had a heart attack here, I wonder what their outcomes are. I wonder how quickly they get me to a lab where they would do a cardiac catheterization. So I wonder what those numbers look like. And so more and more as people become informed, they're starting to ask those questions as they come in the door, and I'm thrilled over that. I can't wait to tell our story. And we do have it posted, so if they want to see it, we'll show it.
That's very interesting.
Yeah, and it's posted in the lower level down by the cafeteria. We post our hospital scorecard. We update it every quarter, and it's posted down there as well. So if the public, it is right there where public can see it, as well as they can certainly ask for that information.
So infection, pneumonia, that sort of thing, those are probably the primary things that people are considering, or are there other things?
I think people ask questions about how long will I need to be in the hospital. People are asking questions about what do I need to take when I go home? How good are we doing at making sure they understand those discharge instructions? That's really paramount, especially for the older population, because they often don't understand it. So we're doing callbacks. We're changing the way we do a discharge that shows here's what happened to you while you were in the hospital. Here's the medication you were on. Here's what you need to stop taking. And then we call their doctor to let them know, this person needs to follow up with you sooner than later because we're concerned about maybe medications or we're concerned about a wound. But we want to make sure that we help transition them to the next level of care and do our part. We want it to look seamless. We want to be a navigator for them and make sure it's just not an episode. So yeah, people are looking at all of those different elements today, but when you come to the emergency room, that's probably not the first thing on your mind. So we need to do it whether you ask it or not.
Now, our time is almost up. If you could sum this up into one thing, or is there anything that I haven't covered today that you want to make sure that the community is aware of?
I just think that Memorial Hospital is the best kept secret. I think I want them to know that we want to take care of you. We want to make sure that we're a community hospital that you can turn to. We want to be accommodating. We want to make sure you know and expect good care when you come. And we are really making it a strong purpose to make sure that that is what resonates in the hearts and the minds of patients and their families when they come, is that we cared about them and that we helped get them well using the best evidence-based practice that we could.
Anything you want to add to that, Vicki?
No, I mean, I just echo what Jeanette says. I mean, we really want the community to have confidence in us as their healthcare provider, because we are the community healthcare provider.
We're going to get you to the next level of care if we can't do it. So this isn't about keeping you here if we can't provide that care, because that's part of good care as well. But it takes a team, and a team is what looks out for each other to make sure the job gets done. So.
All right. Anything else that you guys want to add before we wrap up today? Do you have anything coming up you want to talk about?
Not right now. Kind of quiet season, and we have a few events coming up in the fall, so we can talk about those next month.
All right. And of course, people can find more information on your website. You guys are on Facebook as well.
We are. Yep.
Thank you
All
so
right.
much.
Thank
Thank
you.
you so much, Vicki Bird and Jeanette Huntoon with Logansport Memorial Hospital.